To understand the difference between product performance in the real world as opposed to clinical trials, we need to define it and understand how we have to analyze it. Let me start with assuming that real-world product performance can be defined by the product's patient-level effectiveness. This means that instead of using the term on a cohort level, describing the median survival benefit of the product, we want to know which patients benefit from getting the treatment. To analyze this aspect, we need to understand an essential difference between clinical trials and the real world, namely that patients in the real world do not get their treatment randomly. Imagine having patients selected into a randomized clinical study. As the name implies, the patients will be randomly assigned to the treatment, forming two populations with approximately the same amount of patients having the same sex, age, and other physical or medical characteristics. In real life, however, patients are assigned to a treatment as decided by the oncologist. Only patients who physically or medically have less likeliness to benefit from the treatment will not receive the product. In most cases, the treated group will be much larger than the non-treated group, but most importantly, patients' characteristics differ in both groups. This is the so-called selection bias, which should be corrected for before both patient groups can be compared on effectiveness level. The solution for correcting for this bias is a method called propensity score modeling. This method calculates each patient's probability to be assigned to the treatment depending on their characteristics. It then matches those patients with similar probabilities. The second aspect we want to investigate is how to define patient-level effectiveness. In current comparative studies, success of a treatment on a cohort level is based on the median survival of the population. When this is higher for treated than non-treated patients, the product is a success. However, on a patient level, we want to know who benefits and why. Using survival techniques like Cox proportional hazard modeling, we can predict the survival of a patient irrespective of his treatment. Imagine 4 patients being treated for the disease. Their survival is observed. Using this technique, we predict their survival when not being treated. Apparently, most of them benefit a lot from the treatment. However, for some patients, the treatment will not work. So, why is this distinction important? If we know for every distinct patient whether the product was a success or not, it is possible to use supervised machine learning to obtain more information out of the data. For example, it is possible to classify the treated patients in a success group and a failure group. A simple decision tree can then categorize the treated patients in a success group and failure group depending on their patient characteristics. Using this technique, it can now be interesting to analyze why some patient groups from whom we normally would suspect that they benefit seem to be worse off. Is there some characteristic of the patient in the real world that we are missing? Hopefully, this analysis will give more answers.
Created using Powtoon.